Hello, and welcome to Everyday Health News with your hosts,
Alexa Schaefer.
and Bretta Nino. Today, we will be talking about diabetes, a disease that affects over 10% of the population in the United States.
Diabetes is caused by too little insulin production in the pancreas, or cell resistance to insulin. Therefore, there are two types of diabetes.
That's right. Type 1 diabetes is thought to be caused by an immune system attack on the beta cells within the pancreas. Once the beta cells are destroyed, insulin cannot be created and thus glucose cannot get into the cells. Type 2 diabetes is usually caused by unhealthy eating habits and little to no exercise.
When you are eating unhealthy foods and not exercising, a layer of fat begins to build up around the cells. The fat layer can be very destructive towards your receptor sites that are necessary in order to allow glucose into cells.
This fat layer can actually destroy the receptor sites completely. If the receptor sites are destroyed, insulin cannot act as a message provoker and therefore glucose has no passageway to get into the cells.
Homeostasis is very important in a diabetic's life because the body is constantly fighting to keep equilibrium. Actually, the body can overwork itself so much, it can become run down and stop functioning.
It can be seen within the pancreas, especially in type 2 diabetes. If the pancreas senses the high blood glucose level in the blood plasma, it continues to send insulin into the blood until the high glucose level returns to normal. Sometimes it works so hard, it can damage the beta cells and cease to make insulin, which can damage the organ forever.
Besides damaged organs, diabetics are affected in almost every aspect of their lives.
That's right. Don't go away because right after these messages from our sponsors, we have an exclusive interview with the best doctor around here.
Hello, and welcome back. I'm here with Dr. Big Mac and one of her diabetes patients. I have just a few questions for you.
Okay.
How do you test for diagnosed diabetes?
Well, first you start off with a glucose tolerance test, and this will tell you whether you are diabetic or not diabetic, or even potentially pre-diabetic, and then you move forward onto an insulin tolerance test, and that will tell you whether you are type 1 or type 2 diabetic.
How does the body regulate blood sugar?
Well, when you eat food, your brain signals insulin to production in the pancreas from the beta cells. Insulin travels to the bloodstream and liver. While in the bloodstream, it unlocks the cells, and glucose can enter the cells and act as an energy source. In the liver, the insulin changes glucose into glycogen to store it for later. When the blood sugar is low, glucagon is released from the alpha cells to change the glycogen back in the liver back to glucose and use as energy. This is the process of homeostasis in the feedback loop, and this is why homeostasis plays such an important role in a diabetic's life.
And how is this different in type 1 and type 2 diabetes?
In type 1 diabetes, your pancreas stops producing insulin, therefore you need an insulin pump or an insulin injections in order to maintain homeostasis. And in type 2 diabetes, your insulin receptor sites on your cells are damaged, therefore the insulin cannot unlock the cells for glucose to get into. And in both types of insulin, glucose would never be able to enter the cell and provide energy.
What would you recommend in terms of a basic diet to a diabetes patient?
Well, I would make sure to include a variety of fruits and vegetables which supply the body with important nutrients, and try to stay away from foods that are high in saturated fats, cholesterol, sodium, and trans fats. Remember that carbohydrates or carbs are good on how they provide energy for us, but too much can cause weight gain.
What might happen to a diabetic who is not treated?
Well, some short-term effects of diabetes are ketones in the urine, lack of energy, and nausea. And long-term effects of diabetes include ketoastasis, gangrene, permanent organ damage, and that can eventually lead to death.
What are the most important things you would advise a diabetic?
To eat healthy, exercise regularly, and check blood sugar levels to manage the disease, and just to make sure that you're living and maintaining a healthy life with the disease.
Thank you, Dr. Big Mac, and your patient.
Okay, now I'm with my patient Sarah, who has had diabetes for a few years now, and at first she wasn't so well at treating it, so she has developed a few long-term complications. And as you see here, she has a hearing aid because, like I said, she didn't really treat it at first and just had developed some ear complications. So, that's just one of the long-term effects that are obviously not good for your life. And she also developed complications, and before the disease, she didn't need glasses, she didn't need contacts, but now, after the disease, she she does need it because she didn't treat it like I have said. And as you see here, she wears a lot of footwear because she developed very bad gangrene, and she doesn't like to expose it, especially around people at school, at work, and so she always wears socks and just closed shoes to make sure that it is not noticeable. But of course, at times she needs to air it out, soak it to kind of like get rid of it. And yeah, she has also developed some oral problems within her mouth, and as you can see, open up. In there, she just has a lot of oral issues. Some of her teeth are just kind of like falling out. Not really that great.
You don't want to see it.
So yeah, you really don't. And yeah, so this is Sarah.
You didn't even tell them I have 3 strokes.
Oh yeah, and also she's had 3 strokes in the past year from diabetes. So
And strokes are not very fun to have, you know?
oh god, cut!
Hello, I am here to tell you about my experience with the Diet Essential Bar and how it helped me turn my life around. I used to not care what I ate, and I used to never look at nutrition labels on most foods. But then I was diagnosed with type 2 diabetes. I have been eating this bar. My diagnosis has been completely reversed. With eating this bar, you also have to exercise regularly. You can find this bar at any of your local convenience stores. With all the necessary macromolecules in this bar, a healthier diet is guaranteed. A faster way to eat carbs, proteins, lipids starts with this bar. Buy now.
Hi, my name's Sarah, and I'm a type 1 diabetic. Ever since being diagnosed when I was a teen, I've had to take insulin shots. Ouch. But now, I have a new technology that's the insulin pump. It regulates my blood sugar without having any pricks or pain. I can do this struggle-free. Thank you so much for this pump. I love it. Go buy it today at any of your local convenience stores.
That exclusive interview was insightful in regards to the disease.
Yes, and I know it may seem scary, but it's better to get diagnosed and treat diabetes than to ignore the disease and receive the very deadly implications.
And not to worry, because there are some very modern medical innovations that can help manage the disease in an aggressive and effective way.
Some of these innovations include implantable devices to manage weight and hunger, movement of stem cells to reprogram and teach the pancreas, artificial pancreases, and smart glucose meters to make recommendations toward the adjustment.
Suspect you may have diabetes, make sure to call your doctor today. If caught early, type 2 diabetes can be completely reversed. We hope this program has been informational and helpful. Diabetes affects so many, thus it is important to be educated on it.
Thank you for tuning in to Everyday News, and we sure hope you don't have diabetes.
Have a great day.